Hello, everyone, and welcome to this discussion about improving equity with GIS. My name is Este, and I serve as the Chief Medical Officer at Esri. And I know I'm not alone when I say that I'm very happy to see more attention paid to this topic, especially with regard to racism and health equity. It's about time, really, that these topics were front and center. But to be fair, these topics are really complex topics. I mean, think about it. There's no single driver of health inequities. The problem is multifactorial with a plethora of stakeholders. There are lots of challenges that are occurring at the same time, and there are scads of data variables that need to be considered. For this same reason, there's also no single solution to resolving issues of racism and health inequities. And that's why I'm really looking forward to hearing the various approaches from this panel of innovators. So let me introduce our guests for this session. We have Zach Swingen, GIS Specialist at Milwaukee County Office of Emergency Management. We have Dr. Benjamin Weston, Director of Medical Services at Milwaukee County, and Pierre Gerard, Transportation Planner at Oakland Department of Transportation. Welcome, all of you guys. I'm happy to be the only woman talking to a bunch of talented men. And I really want to dive right into this. So I'm going to begin with a question that I'm going to pose to each of you. Now, each of your organizations takes a really proactive approach to equity. And so I'd like to ask if you could just spend a minute or two talking a little bit about what this looks like in your organization. And Dr. Weston, I'd like to begin with you, if that's okay.
Yeah, sure. Thank you. So in Milwaukee County, I think a lot of our approach to equity goes back to just about 2 years ago when Milwaukee County was one of the first in the country to declare racism a public health crisis. And that's informed what we've done in Milwaukee County ever since, how we approach issues, how we approach challenges. And that wasn't different with the COVID-19 pandemic when it first started. What COVID did, I think, in Milwaukee County, as well as much of the rest of the country, was really put a spotlight on racial and ethnic and vulnerability disparities in our community. But it did it in a very short time period. So for a lot of disease processes, we think of cancer, high blood pressure, strokes, they certainly affect our vulnerable communities more, but they take years, or in many cases, decades to really show up. COVID was different. In our community, we could watch day by day and certainly week by week and see those same communities that suffer our burden of disease also suffering an undue burden from COVID. And so from a GIS standpoint, when we put together our Esri dashboard initially, our county executive asked us, and we were on board and enthusiastic about showing the disparities of race and ethnicity right up front. And that's still the case. If you go to our dashboard, we have a lot more tabs than we did in the very beginning, a lot more tables, a lot more figures. But what's remained is that on the front page, highlighted is race and ethnicity information for cases, for hospitalizations, and deaths. And it wasn't because we were doing well from that perspective. In fact, when the data first came out, Milwaukee County was doing some of the worst as far as our disparities from COVID. But we wanted to show that to inform our interventions, to inform our resource management. We've continued to do that through vaccinations today as well.
I think that's so amazing. And I really appreciate what you said about that, you know, a lot of this has already been there and some of it takes longer with some of the chronic diseases, but COVID putting a spotlight on it seems to me to be a potential upside of a miserable situation that maybe it helps us all to react faster. And Zach, I know you're a part of this same organization in Milwaukee. So can you add anything to Dr. Weston's comments and how you're sort of working to approach equity from your role?
Yeah, I'd like to mention that the coronavirus dashboard that Dr. Weston spoke about is actually kind of, I like to think of it as the culmination of the work that the county's been doing since 2019. We've been trying to, since that declaration of racism as a public health crisis, bake racial equity into everything we do at the county here. The county's approach mainly focuses on addressing the root causes of racial inequities, which are the power structures, the policies, and the practices of our institution. And that's led to a lot of initiatives within the county, such as mandated racial equity training for all county employees, the creation of racial equity ambassador program to embed racial equity representatives in each department, partnering with organizations like GARE, or the Government Alliance on Race and Equity, that also seeks to advance racial equity. And it's also led to the creation of things like a racial equity budget toolkit for our departments to use, and the signing of an ordinance that ensures racial equity is a top priority of Milwaukee County government and remains larger than any one government leader. So I really like to see, or I like to look at the coronavirus dashboard as kind of the end result, one of the end results of all the work that we've been doing since 2019 to bake racial equity into all of our decisions and actions moving forward.
I am thinking about this statement of baking racial equity into everything that you do. And it reminds me when I was in public health at the California Department of Public Health, we talked about, and many places do, health in all policies. And it just made me think of, and maybe somebody said it before, but maybe what you guys are practicing, we could call structural equity instead of structural racism. You know, you build the structures to improve the situation and ensure equity. So thank you from Milwaukee, our duo there. And Pierre, I want to turn to you and ask you the same question and how your organization is approaching equity and a little bit about what that looks like for transportation in Oakland.
Right. I guess it's helpful to start with a definition for us. In Oakland, we define equity as fairness. So it's a very simple definition. And for us, fairness is about how identities such as like race, ethnicity, gender, age, disability, sexual orientation, that none of those identities have a detrimental effect on the distribution of resources or opportunities or outcomes for residents in the city. And so we established a Department of Racial Equity in 2016. And shortly after that, the department I work for split off from the Public Works Department and became the Department of Transportation. And we actually have racial equity written into our charter as a priority for the department. And so all of these efforts around equity are like very recent, considering the history of our city and the history of racial inequities in this country. And so the Department of Racial Equity and the Department of Transportation that I work in have been working pretty closely together. And through that collaboration, we formed a racial equity team in the department. I'm a member of that racial equity team. I'm a pretty recent hire, but I'm also a co-lead for the data analytics subcommittee of the racial equity team. And I guess the most GIS relevant example I can provide for some of the work that we've done is the creation of a geographic equity toolbox in which we use demographic data to prioritize census tracts with the highest concentrations of people to whom a set of priority factors apply. And those factors are race, income, and those being the most important factors, predicting, for the most part, where all the other factors show up as priority neighborhoods for the city. And our methodology, we developed in-house by our staff. We developed it on a scale instead of using like a binary yes or no, like is this factor here or not. And every census tract is compared to citywide data. And so this geographic equity toolbox is very Oakland specific. It's very useful to us, and And so that's been something that we've been focusing a lot on lately. We've used it in a number of programs like the capital improvement program that gathers and ranks public requests for capital projects in the city. We created this priority neighborhoods map layer that helped increase the number of requests coming from historically underserved parts of Oakland that were identified as priority high and highest priority neighborhoods. We learned that street sweeping citations were being given out in highest and high priority neighborhoods at a rate of about 43%. So higher than we'd like, considering our values, and a number of other projects. And we developed this tool within the last like year and a half, and it's already been quite useful. And we'd like to kind of see it through and start working on evaluating kind of some like more tangible outcomes of our actions as a result of those changes. And there's a lot more I could say about how we approach equity, but the fact is that we have a department that kind of helps keep us on task. We have a racial equity team that helps keep us on task to work on equity related issues at all times. And we work racial equity goals into our work plans as employees here at the city. And yeah, we're really always thinking about it.
I think that's awesome. And don't worry, Pierre, I'm going to give you lots of opportunity to say more about how you're approaching health equity. But I'm sort of struck by, I feel like your department got into this around when we were seeing a lot of health equity offices pop up. So 2016, well before the pandemic. But I'm wondering for you, you mentioned that your geographic equity toolbox has been around for about a year and a half, but you mentioned a lot of different departments. So how did the pandemic really impact the work that you did? Did it change the focus or add additional tools? How did GIS help with equity for the pandemic?
The best way I can answer that from my department is that we got some national attention for starting a slow streets program. Other cities implemented similar strategies to create more space for physically distant walking, biking, and other physical activity to alleviate crowding on sidewalks. But our program is called the Slow Streets Program. We implemented it around when shelter in place started in mid-March of 2020. And through survey responses and working with community-based organizations in some of those priority neighborhoods I mentioned that we identified in the geographic equity toolbox, we learned that that these slow streets weren't benefiting everyone the same way. And we have some like very good quotes from some of our like council members and community-based organization leaders about kind of exactly how that looked for them. And so what we heard was that that there was more of an interest in creating temporary traffic safety improvements at pedestrian crossings so that people could have greater access to grocery stores, food distribution sites, which were pretty important during the pandemic, people without income, and COVID-19 test sites. And we prioritized these improvements on areas that overlaid with the city's high injury network, which is our data set of where traffic crashes are higher in the city, and simultaneously with the highest priority neighborhoods layer, according to those racial equity indicators such as race and income. And those programs we're still evaluating. We believe that that they meet the needs of neighborhoods bit more than the Slow Streets program. The Slow Streets program works for the folks who it works for, and we called this new program the Essential Places program. We like to name things just to kind of help rally people behind the programs. And I think it's definitely still a work in progress. We don't like to settle too long on any particular strategy to kind of trying to meet people's needs, because the structural inequities in our city are so pervasive that no one strategy that we come up with right now is really going to I think meet everyone's needs. And so getting down to this kind of neighborhood by neighborhood approach to addressing people's needs, especially through the pandemic, which kind of created this enormous opportunity for us to kind of demonstrate kind of where our values are, and to show how quickly we can pivot from kind of strategy to strategy. I think was I think it was very inspiring from where I sit, and I think it's also frustrating in how it doesn't and how it shows that no one strategy is going to work for everyone, and so it's both. It's frustrating and inspiring.
Yes. Isn't that how things often are? But you make a good point, and I think it's so true, which kind of opens maybe the next question up that I want to start with Zach on this one, because I know you're one of the GIS experts here. Why do you think that GIS is a critical tool for addressing equity? I mean, you and Dr. Weston spoke about the COVID dashboard and some of what you were doing with relation to the pandemic. But why GIS? Why is it an important tool? We obviously have ideas. We think it can help us to understand outcomes or the processes we take, or maybe some of those structural problems that we spoke about a moment ago. But what do you think? Why GIS? Why do you care?
Well, I think GIS is so helpful because so many of our life outcomes are determined by the zip code that we grow up in. And in many cities across America, Milwaukee in particular, remain very segregated. And this is due in large part to the historical racist practices of redlining. So our Milwaukee County Land Information Office actually created an application to overlay historic redlining boundaries with modern geographic boundaries. And this application allows users to visualize a very tangible example of systemic racism implemented by the federal government. But by visualizing these historic boundaries, it also allows Milwaukee County to identify current neighborhoods and areas to invest in to address these decade-long inequities. And fast forward to today, when the CARES Act was passed in spring 2020 to issue grants for small business recovery as a response to COVID-19, our Land Information Office also created an application to visualize and analyze the grant distribution. So that application allows Milwaukee County to analyze if the distribution of the funding was equitable. And by mapping the information, geographic and demographic gaps in that data become easier to identify and correct. But more to the overall point, I think that by visualizing, understanding, and communicating what's going on in our communities, GIS can help us bear witness to inequities centered around race. And aside from telling stories, we in government can use mapping to help drive our decision-making, particularly around resource allocation, so that we can do our part to move the needle on racial equity and bring down those disparities and outcomes. And something that I'm sure, Este, you've probably heard working in the GIS field, in geography, the saying that a map can tell a story in the blink of an eye. And I just think back to all the 40-page plus long reports that I've made in my career that I've watched people sit down with, and they open it up, they look at it, flip through 2 pages, and then after about 10 seconds, flip directly to the back to see that map. And I cannot blame them. I've done it myself, but I think that's because mapping in particular is just such an incredible way to present information and get that story across in a blink of an eye. So not only in resource allocation and decision making, but also storytelling, GIS is a great way to communicate information.
Well, you're kind of preaching to the choir with me, but I agree with you. Surprise, surprise. No, I think that's a really great answer. And I wonder, Dr. Weston, did you come into this already knowing some GIS, or do you have opinions about why GIS is useful in this scenario?
Well, I can't say I came into this with any even remote expertise on GIS. My GIS experience is mostly Zach working with us to provide GIS maps for what we did before COVID, which we still do, which is largely overseeing our EMS system. And so, for example, Zach put together a map that overlaid cardiac arrests in our community. And we see a strikingly, maybe not surprisingly, but still strikingly similar appearance between where our cardiac arrests are densest in our community and where COVID is densest in our community. But one application that I think we took from this that made GIS particularly applicable to equity was developing new ways to look at and understand the disparities in our community. And so, for example, we developed something called the EVE model, so evaluating vulnerability and equity. And we could, on a map, see the areas that combined high vulnerability, so communities that by social vulnerability index were high vulnerable communities with low vaccination rates. And that model, it highlights those communities in orange. And the communities that are the orangest are the ones that are the most vulnerable and the least vaccinated. And that's been a great tool for our county to understand, how do we focus our messaging? How do we focus our resources? How do we focus our interventions? So when we're having pop-up vaccination clinics, when we're going knocking door to door, trying to talk to people about vaccines, those are the communities that we're targeting. And so I think that's one tangible example of how GIS has really brought a novel approach to vaccination and to public health efforts, and ultimately to equity in our community.
Sounds like you guys are doing amazing work, and I, for one, and I'm sure many, appreciate it. And I know I've seen a lot of the work that you guys have done, and I just want to encourage everybody to take a look at the websites for these organizations and see what you can learn from them beyond this discussion. So Pierre, I want to ask you, I mean, your business in transportation, it seems to me as an outsider that so much of what you do has got to be around accessibility. And how can you even do that without GIS? I mean, the old ways were pretty rough, not very accurate. So can you add to why you think GIS is an important tool for addressing equity from the transportation perspective?
Yeah, definitely. Spatial data helps us answer where inequities are occurring along our transportation networks, and that's it. It doesn't inform what we should do about it or why the inequities are occurring. But I really liked what Zach said about how spatial data, when visualized, it feels very tangible. It feels like something you have to respond to once you see it. And so, yeah, I think it's fairly straightforward. Like when you see where the inequities are occurring, I think especially as a city government official, worker, what have you, you must respond.
Yes, and isn't it, I always thought it was so helpful to be able to pinpoint, and by pinpoint, I really mean target very specific areas where you're seeing certain types of inequities, so that you not only can provide the best response to the problem, but you can be more cost effective and efficient rather than trying to apply that broadly over an area. If you know exactly where the problems are, you can do that. And I would think in your industry, that's particularly important.
I agree. Yeah. GIS helps us prioritize where to perform community outreach. And so, again, just kind of demonstrating how GIS, like, it's not meant to replace community outreach just because you can see where things are happening, but it does help you figure out where to ask questions first, instead of just kind of asking the city broadly and ending up with a huge data set that could take a really long time to work through. if you prioritize neighborhoods that need aid most based on historic inequities, then yeah, your work starts there. And yeah.
Awesome. So you guys have already given our listeners lots of ideas for how to think about equity in light of GIS. And one of the things that I have, well, for lack of a better word, I'll say complained about with regard to public health is that we're all very mission driven and we do tremendous work, but we're not always as good at evaluating the impact of our work. And so, Dr. Weston, I wanted to ask you, one, if you agree with that at all, and even whether you do or don't, how do you think that GIS can be used to do that evaluation part? Are we achieving our equity goals? Is GIS relevant to that question? And if it is, do you have advice for folks on how to do it?
Yeah, I think it's a really important point. So a lot of times I think we're very good at building tools, but we're not as good at figuring out how to evaluate those tools. And so I think it's something that we've worked to build into our dashboard. So going back to the EVE model, we put up the EVE model, and then to the right of the EVE model is our trend lines to understand how the vaccination rates in our more vulnerable communities are changing over time and how the model has impacted that. Now, I think the next step that we take, and putting on my academic hat for a second, I think the next step is disseminating that and really evaluating that so that, you know, if it works great for Milwaukee County, or if it doesn't work so great for Milwaukee County, telling others what we did, how it worked, how to replicate it, and what outcomes we really found. And so I think that's one of the next steps once we can kind of, or maybe now that we can start to take a breath as hopefully the pandemic in the United States at least is becoming more mild, we can look back and say what worked and what didn't, and how can we disseminate that knowledge.
Yeah. So Zach, how are you going to make that happen for Dr. Weston?
Well, that'll be a discussion between him, myself, and the rest of our team. Exactly how to make that happen.
Well, but what are some of your ideas for using GIS to evaluate equity? What would you do first if you were going to take on that task?
Sure. I think understanding what our community, what the needs are of our community, and then, as Pierre said, you can have a nice map showing where things are wrong, but if you don't actually ground truth and engage the community and make sure that that is accurately reflecting what's going on, you are just kind of glossing over the problem again. So I think for the future of Milwaukee County, we're definitely going to be incorporating GIS into understanding the needs of our community and aligning our services to meet them and watching how those trends change over time.
Awesome. I think that's a great way to get started on evaluation. Pierre, do you have any other thoughts on why GIS can help us evaluate our impact on equity?
I guess to draw upon a quote that really has more to do with data in general. Take this as you will. Yeshimabit Milner, who's the executive director and founder of Data for Black Lives, said that for far too long, data and tech have been weaponized against community, but we have examples of technology for positive social change, like GIS. Data plays a huge role in allocation of resources, and so these tools have a role to play in equity and to help elevate the voices that have been silenced. And this call to action is more urgent than ever before, especially with 2020's racial reckoning, as I think we all remember, and is ongoing. And so the question that the city of Oakland uses to ground our work, shared by Yeshimabit Milner here, is how do we use data to expose inequity and hold governments accountable? And so like this isn't an exercise in shame or anything like that. It's just an exercise in just kind of putting our resources where our values are. And, we're moving away, I think, from this trend of having just stating our values and actually doing something about them. And GIS, yeah, like you said, is a very efficient tool for trying to show people that we are responsive without just kind of giving people the impression that we're just kind of checking a box off, like kind of on our list of like tasks. It helps us kind of pivot more quickly and be responsive, and basically just kind of humanizes city government and hopefully, all levels of government in this country. So.
Thank you. I love all of what you just said there. There was a lot there, but particularly the part about GIS being a part of humanizing technology. And I think it goes back to what you and Zach were talking about earlier, that the data on a map is somehow compelling in a different way. I think it draws people in. I've always thought, and maybe it's just me, but I always look at where I live and where my family lives and, what's happening where the people I care about are. And so you're drawn in immediately and you start asking questions and interrogating the data based on your own sort of face validity that you're imposing on that map. And it's very interesting. And I think about that often, that, technology could in some ways be a barrier when you're talking about inequities and the digital divide and all of the things that dehumanize people. So I really love that you mentioned that, because I think certainly GIS could be a dehumanizing technology, right, if we use it incorrectly, but it's such an important point that you make, that there's real opportunity to have that level of engagement and inclusion. So thank you for that comment. And I'd like to give everybody a moment to tell everybody who's viewing what you plan to do in the future. I mean, you started, Dr. Weston, mentioning some of your future plans, but this is your moment to talk about how you want to use GIS to address equity issues in the future, what's next for your organization, and any advice that you want to give to people. So since you started with it already, Dr. Weston, I'll turn to you first.
Sure. So I think we've learned a lot over the last, 16 months of the pandemic, and we've learned a lot in all sorts of different areas. But I think part of that is how we can use data, how we can use mapping, how we can use GIS to inform the community and to inform the interventions that are going on in the community. I think one of the things that struck me the most after we put up our dashboard was we knew the internal stakeholders that were going to use it. We knew it was going to be public facing and members of the public were going to look at it. What we didn't know were all the other groups that would use it, the academics that would use it for their studies, the community organizers that would use it and sit and scribble down the data every, once a week to figure out what their next intervention was going to be. Those are the groups that we didn't anticipate. And so I think understanding that and understanding the influence that mapping in particular, like you mentioned, because of the familiarity, because of the approachability that it gives this sort of a dashboard, I think we can take that learning that we had from COVID and apply it to many other health infrastructure and public health initiatives that we'll have in Milwaukee County, that we'll have in Wisconsin, and better understand what's going on with public health, but also better figure out better ways to approach those issues.
I look forward to seeing all of the work that is yet to come. Thank you so much. And Pierre, what is next for Oakland?
Well, I think it's, as I described earlier, we definitely want to develop a consistent method of evaluating tangible outcomes of our projects from the equity lens that we've been developing. For instance, if the geographic equity tool tells us or helps us repave more streets in priority neighborhoods, especially in Oakland, such a seismically active area and with a lot of drainage issues on our streets resulting from some of those historical inequities. we want to measure whether that extra paving actually improves the quality of life for people living in those priority neighborhoods. And so we have our racial equity team in the Department of Transportation to help ground us and drive us forward. We're going to continue to use the geographic equity tool and update it as new data is made available, and really just kind of keep sharing and learning, sharing like this and like right now, and learning from other organizations, and hoping that that will help us develop a tool that I guess can kind of take us a step further than what we've seen kind of so far with the geographic equity tool. Like right now, we're just moving our money around towards projects that we think need them more, and so to see those projects actually changing people's lives. It's such a big question, and like how do these projects actually change people's lives? For instance, like if those paving projects only support people passing through those neighborhoods, not people living in those neighborhoods, then we've got to rethink what we're doing. So yeah, a lot to think about.
There is a lot to think about, and I love the level of detail that you get into. And I'm guessing because you've mentioned it a few times and people love tools, you're probably going to get some inquiries after people view this about what does the geographic equity tool look like. I'm guessing people will want to use such tools themselves. So Zach, I'm going to give you the last word to mention anything else that you see in the future for Milwaukee in using GIS to address equity.
Thanks. I have to mention that Milwaukee County is one of 5 jurisdictions in the country that was selected to participate in a pilot opportunity to cultivate and pilot leading edge geospatial solutions to support governments in advancing racial equity, which is a partnership with GARE and Esri, so the Government Alliance on Race and Equity that I mentioned before. And we're all really excited about that and excited to see where it goes. Also, I do have to give a shout out to the Milwaukee County Parks system because they've created an equity index that assists staff with considering racial equity in decision making, and it allows the county to think spatially of the 157 parks and parkways in our system, which ultimately helps to plan how resources are distributed in an equitable manner. And just on a broader note, I think that after seeing what GIS can bring to the table during the COVID pandemic, Milwaukee County will be finding a plethora of other ways to use GIS in the near future to better understand our community so that we're able to better serve our residents. So truly trying to understand and represent the needs of our community and making sure the services that we provide across the board do their best to meet those needs.
What a great last word. So I want to first say thank you so much to Dr. Weston, to Zach, to Pierre for being here and sharing your ideas. And I also want to thank our viewing audience for spending the time with us. I'm certain you got lots of food for thought, lots of great ideas of really detailing why geography matters to creating the health equity that, as the gentleman said, aligns to our values. So, so we invite you to visit our Racial Equity Hub, to look at our websites on health equity. And like I said, please visit the websites for Milwaukee County and for Oakland Transportation so that you can really see what this looks like when it's being executed. So thanks again, and thanks for watching. Bye, everyone.